a lasting solution to the violence and social-political crisis rocking the country.
There's fear, there's apathy. Everywhere there's fear and tension in Nigeria. So we are calling for peace. We need peace in Nigeria. Without peace, there will be no development. Without peace, there will be no growth. Without peace, there will be no meaningful development. So today we are saying we need peace in Nigeria. Today is a day of calling of ceasefire for hostilities. 24 hours call for ceasefire to strengthen the ideas of peace. What are the ideas of peace? Freedom, respect, fundamental human rights, respect for fundamental human rights. From the cases reports we've had from the north, women are already displaced from the northern part of Nigeria. They are all displaced all over the other bordering countries, all over surrounding Nigeria from the northern parts. How do we get all those women back in place? How do we know what they are suffering? They are suffering homelessness, they are suffering hunger, they are suffering poverty, they are suffering sexual abuse, they are suffering all forms of violence you can even imagine.
250 primary school buildings newly reconstructed by the Rivers State government will be commissioned by October this year. And this is part of ongoing efforts by the government to improve the quality of education in the state. Governor Chibuike Amaechi said this on our weekend magazine program, Sunrise.
Like I told you, I think we made an assessment of what we first said education in Rivers State has deteriorated so badly that people have abandoned public schools to poor men's children. So what did we do? Well, after the assessment, we discovered that we had to deal with three issues. First, quality of teachers. We have to train teachers. We got the British Council to help us train teachers. They in turn hired Cambridge to train our teachers, and they began the retraining of our teachers. When we finished that, well, it's ongoing. I would say we finished, but having dealt with that, we went ahead to say, look, the quality of buildings, the environment by which children learn is not conducive. We began to rebuild schools. We're not renovating. There are 1,300 schools that we met. No desk, no sanitary facilities, nothing, no offices for teachers. We brought, as we reach your school, we knock it down and we rebuild. And in the schools, we are building 14 classrooms, 16 toilets, and then you have auditorium, you have computer lab, you have library, then you have a sick bay, and then you have a reception class. We not admit you to primary one. We admit you first to reception class for 1 year, preparing you for primary one. So you go from reception class to primary one, and proceed until you get to primary 6. Having done that, we look at the secondary school. Now we're beginning to build new secondary school that costs us 4.5 billion per school.
The Rivers State Governor Chibuike Amaechi. The quest for quick wealth and power has landed a father of a 3-month-old boy in a police net. Mr. Polycarp Tajan was arrested by the police in Plateau State for killing his son for ritual purposes. He was paraded alongside others suspected to have committed various crimes, including Habakkuk Fuagwom, who is accused of beating his 2-year-old daughter to death for bedwetting. Do you know that children can also be diagnosed with cancer? However, identifying the symptoms and what parents should do are a major concern. A non-governmental organization, Children Living with Cancer Foundation, says awareness about this disease in children is low in Nigeria. The group wants to change this and took its message to the streets of Lagos.
It's not typically diagnosed in adults alone. The disease can also be found in children. A non-governmental organization, Children Living with Cancer Foundation, embarked on an awareness walk within Surulere, Lagos, to spread the message that cancer in children is curable.
Sometimes most of the children arrive at our area late, where the cancer has spread all over the place, when there's little you can do. If they are caught early, then the chance that we are going to cure them become higher.
The challenges we have mainly is the awareness, because still we'll have parents coming having no clue whatsoever that children have cancer. Even when we go for outreach programs and we're trying to give people our flyers, they reject it in Jesus' name. It's not their portion. They don't collect the flyers.
Doctors say it is difficult to define the main causes of cancer, but the associate causes always call for precautionary medical attention.
In children, mainly some infection that have been associated with some of the cancer that we have. Like the Epstein-Barr virus has been associated with bucket lymphoma, which is one of the commonest cancer in Nigeria.
Children Living with Cancer Foundation conducts most of their surgeries in Nigeria, and 5-year-old David is a cancer survivor. While David's parents were fortunate, this man was not.
It all started when he was 1 year, 8 months. I noticed that the right side of the belly was swollen and hard, different from the other side of it.
It started just like he had temperature. And when a child had temperature like that, next is to give him paracetamol, this thing. So we gave him that. After 2-3 days, we didn't see improvement. Then we have to rush him to a private hospital. Eventually, I lost the boy after 7 months in hospital.
Statistics show that cancer can be found in 22 out of 100,000 male children, while female children are said to be less affected. Whatever the numbers, the Children Living with Cancer Foundation is seeking support to purchase more equipment in its quest to give life to those who barely have begun to live.
Well, malaria is another major disease that has killed and continues to kill millions of people globally. The scourge has continued to generate a lot of concern for Nigeria and other countries around the world. Now, about a month ago, the United States successfully came up with a malaria vaccine. Our focus on health today looks at what this breakthrough means for Nigeria.
Malaria is a life-threatening disease caused by parasites transmitted through mosquito bites. Stagnant water and dirty environment can also lead to malaria infection. Going by the World Health Organization's report in 2010, malaria caused an estimated 660,000 deaths with an uncertainty range of 490,000 to 836,000, mostly among African children. Understanding the burden of this disease, the federal government is working to reduce the death rate associated with malaria.
So far, since 2010, we have distributed almost 60 million long-lasting sectorial kit tests in all the states of the Federation and the FCT. And we are currently working on introducing a nationwide treat, test, and vaccinating. But that will follow after consultations with the governments.
More funds have been provided nationally and internationally to combat malaria. More techniques are available to us, and there is more acceptability of the strategies in place. We are moving away from attempting to control it to getting rid of it in its totality. That is progress in our plans. So now we are moving away from just controlling, limiting to total elimination of the parasite in our shores.
Tackling this disease is not only Nigeria's business, as the United States recently conducted an experiment with new malaria vaccines which proved to be safe and can generate an immune system against the malaria parasite in healthy adults. But here in Nigeria, some doctors are not excited about the development.
When this new scheme, that there's a new vaccine that possibly will help us to eliminate malaria, I was not too enthusiastic, because knowing fully what has happened in the past. In the late 80s, there was a vaccine called developed by a scientist called Patriario. That vaccine was effective, up to 70% efficacy on the field. After some few months and years, the efficacy dropped to less than 20%. So, and the question is, why so? Why? A vaccine is a very expensive venture. It's a very expensive venture, a research venture that is being taken outside the country where malaria is, unfortunately, outside the country where the malaria is not a major problem. The investment of the United States government on vaccine run to billions of US dollars in the last 20 years. Research generally is very expensive. And we do not, that culture of investing into research has not come to play in the country.
Right now, there is no vaccine for malaria. There's no vaccine to protect us against malaria. We should develop a herbal